My name is Lori Hurley. I'm a program manager at STAR Clinic, and I'm so happy to welcome all of you who are colleagues, friends, and collaborators. Some of you are new collaborators. Some of you we've worked together for a long time, but we all have the same goal: to provide quality care for LGBT people. And today we're going to talk about our new Monday night initiative. I'd just like to emphasize that STAR is here Monday through Friday, every day, and our team has worked for years to provide quality, excellent care to everyone who needs it. And we'll be continuing to do this, and this new initiative is another way to provide a welcoming, safe, and competent space. So with that, I'd like to introduce our new clinic manager, a fantastic addition to our team, Daryl Thomas.
Thank you so much. Thank you, Lori. So my name is Daryl Thomas. I am the STAR Health Center clinic manager, and I self-identify as a gay man. And so that's why today this is very exciting for me. This is a huge endeavor for STAR program, and in particular, STAR Health Center, because we're going to be providing need and care for a community who's in dire need of it. So enough about me. I'm really here to introduce to you our welcome speaker. He is our leader. He is our captain. He is the Distinguished Service Professor of Medicine and STAR Program Director, Dr. Jack DeHovitz.
Thank you so much, Daryl. Thanks so much, both of you, actually, for the introductions and also helping organize this, as well as our whole outreach team. It's a tremendous effort. And Lori's comments at the beginning were so important because she spoke about quality and community. And those are the two themes that I think resonate throughout our development. And I'm just going to take a few minutes here today to talk a little about the history of STAR, because I think it gives you the sort of setting you need to understand on how we got here to this day. So we were created in 1990, and by the way, STAR stands for Special Treatment and Research. We just felt that we needed a name to characterize the broadness of our mission. It was really created in the setting of a burgeoning HIV epidemic here in central Brooklyn by really two opportunities. One, Ryan White's funding to help establish a clinic, and number two, NIH funding to deal with another special population that was really being ignored at that time, which was HIV disease in women. And so even then we were concerned about special populations. At the same time, and soon thereafter, we became very much engaged in developing a clinical trials program, again, for special populations, those people of color as well as women. And then with the state's help, we became a designated AIDS center, which meant we provided comprehensive care, both inpatient and outpatient. The 1990s was also notable because not only was the fire burning here in terms of HIV disease, but also globally. And we took advantage again, of research funds to develop a large global effort focusing, oddly enough, on Central and Eastern Europe, which now is the only region in the world with a rising incidence of HIV. Once the 2000s came around, we remained very focused on meeting the needs of our community. Through several CDC efforts, we developed programs to integrate HIV prevention within our clinical care setting. And in addition, we became very much involved in developing special efforts to keep patients in care and adherent to their medication. Equally important, we became very much aware of the burden of substance use in our community. And with support from SAMHSA and other aspects of the federal government, we developed novel programs utilizing buprenorphine for opiate addiction, utilizing acupuncture for patients that have substance use problems, and other modalities to reduce substance use in our population and keep patients in care. This decade has been notable for a number of really key advances. We became the first institution clinic here at Downstate to have something called patient-centered medical home. We were certified by that, and that was just the first of several real initiatives we've had here. We developed a special social media event for young LGBT individuals at risk for substance use. And then finally, we're developing this really critical program to meet the needs of the community. So I hope I've laid out a theme that we've always been here for the community, we work with the community, and equally important, we're at the cutting edge of providing advanced care and high quality care. And that theme, I think, will continue in this new effort, which you'll be hearing much more about from others. So, Daryl, let me give it back to you.
Thank you, Jack. Thanks so much, Jack, for that. So right now we're going to give you a brief description about Star Health Center proper. And the person who will be doing that will be Dr. Jamila Yusuf. She is the Assistant Professor of Medicine and Medical Director for Star Health Center. Please welcome Dr. Jamila Yusuf.
It's great to see so many of you here today. Today is also Spirit Day. I don't know, I think many of you may be familiar with it, but for those who aren't, Spirit Day is a day in which people across the United States will be wearing purple to raise awareness for LGBT youth and also to take a stand against bullying. So it happens every October 15th. It's the 5th year running, and I think it's very timely that we have Spirit Day falling on our open house. So I'm going to talk about our services, and I'm very proud to present the unique services that we offer here at STAR, and also proud of our staff that work so hard and dedicated in providing those services. This is a summary of what Dr. DeHovitz was saying in terms of our timeline and our milestones over the years. So first, to start off with our medical services, I have an example of a select few of our medical and nursing team. We provide specialized HIV care along with primary care services. We provide well women's services, including GYN exams, and we are integrated with our OB department in providing prenatal care for our pregnant women who are positive. We have a grant from New York Department of Health providing hepatitis C screening and treatment for patients who are co-infected with HIV and Hep C. We provide on-site pre-exposure prophylaxis and post-exposure prophylaxis, and you'll be hearing more about that a little bit later on this morning. And we also provide hormone therapy for our transgender population. And another recent addition to our services has been high-resolution endoscopy, which is very much needed for our population. We also provide behavioral health services composed of behavioral health counseling, including substance use counseling. We have psychiatry services available from Mondays through Thursdays, and we provide buprenorphine treatment. 5 of our MDs on staff provide buprenorphine treatment for our patients. We have a very strong care coordination team headed by Lori Hurley, and I have examples of some members of that team here, as well as case management who's on site. With respect to our care coordination team, they work very hard with our very high-risk population in terms of our newly diagnosed and those who struggle becoming undetectable. They also do home visits for our patients. Additional services that we offer include nutrition service, adherence counseling, and we have a very strong Hep C team, including a linkage to care specialist who can go out into the field and link patients back to care at our treatment center here. We have a family program for our women who are pregnant and those with children. We also have a clinical pharmacist who's on site 1 session per week and can offer pharmacotherapy counseling to our patients who have multiple comorbidities. We also offer complementary therapy in the form of acupuncture and Reiki. As Dr. DeHovitz mentioned, we have a very strong quality improvement program headed by one of our PAs, Christina Brown. And we also have peer support, and we have a very active community advisory group. So our front desk staff is, we have some of the members here. We're open every day of the week, as Lori said. Mondays, 9 to 5. And then Monday evenings, we'll have our LGBT Health Initiative clinic. And we open late again on Wednesday evening. And in addition to that, we have a provider who's available 24/7 by on-call phone for our patients who need medical advice after hours. So with that, I'm going to, can you take any questions or?
No, that's fine. Okay. Thank you, Jamila. Thanks so much. So now, just so that we keep things moving, we're going to have Dr. Elliot DeHaan give us a brief description of what services we will have on Monday night for our LGBT community. Dr. DeHaan, he is the assistant professor of medicine at a clinical assistant professor of medicine and director of HCC services at Star Health Center. Dr. Elliot DeHaan.
Okay. All right. Good morning, everyone. Okay. So I thought I'd give a little bit of an introduction as to why we are starting this health initiative on Monday evenings from 5 to 8. And I'd like to start with some maybe not so known facts about the LGBT population, which I identify as a member. And that's individuals who are LGBT or gender nonconforming often experience challenges when they're interacting with the healthcare system. And lots of times this will translate into disparities, health disparities. These challenges include lack of access to care, whether it be lack of insurance or also lack of access to a provider who is competent. And there was a study that just came out fairly recently in the American Journal of Public Health that showed that very few institutions, about 9% of 138 major medical academic centers in the United States, actually have a procedure in place or a way for patients to find an LGBT competent physician. And what came out of this study is that healthcare institutions need a better way for LGBT individuals to access their provider and find someone who they feel comfortable with. And part of our thought process in this initiative is to provide that space and that time for people to be able to connect to those providers. The AAMC, American Association of Medical Colleges, talks about 3 levels of stigma in the LGBT community. One level is at the individual level, the self-stigma, issues of disclosure, another term used quite frequently, internalized homophobia. But then we could take it to a second level where I think people are more cognizant of this level of stigma, and that's the interpersonal level, and that's actual conflicts between individuals, whether it be due to discrimination, rejection, abuse. And then finally, you have structural issues, which a lot of the things I was talking about earlier are also part of the structural problems that we have, and that's access to insurance, access to providers, having healthcare facilities that allow for transgender individuals to be able to use the bathroom and not feel like they have to be discriminated against by a sign. So these are kind of the things that we're hoping to address by creating this space, this welcome space on Monday evenings. Furthermore, we see as part of our mission to also train healthcare providers as well. We are a teaching hospital. We have residents, fellows, future attending physicians of tomorrow who are being trained at this institution. And this space will also allow us to train students and fellows and residents how to be more competent in LGBT-focused care. So that's another piece of the puzzle that we think is really missing and that we can help with by starting this health initiative. I think a lot of the people in the room here are familiar with statistics like this from the CDC, and this is 2010 data that show high rates of HIV infections among MSM, and this data translates into higher proportional rates among Black and Latino MSM in particular, and that's part of our community here in the greater Flatbush area, and we want to create a space where we are welcoming to the community here. Further data shows that there's also an age component as well in terms of HIV diagnoses among MSM. And as you can see, over the years, there has been a trend for younger MSM to have to be diagnosed with HIV, and we want to create a space that young MSM feel comfortable as well. So what will we provide at STAR? Dr. Youssef went over a lot of the details of all the comprehensive services that we have. I will go into a little bit more detail as to what will happen during the LGBT initiative, and everything I say is also available during those outside hours as well. Primary care for both HIV negative and HIV positive individuals. So if you want to get your primary care at our clinic, you can come. Primary care includes screening for age-appropriate malignancies, as well as getting your cholesterol checked, getting screened for diabetes, all the things that you would do in a primary care clinic outside of STAR. We will also provide STI screening as well, and that's also specifically for our population site-directed STI screening. So it includes oral, pharyngeal, anal, and genital screening for gonorrhea and chlamydia. We will also be providing screening for syphilis, hepatitis B, HIV, and hepatitis C as well. We will also be providing, among other vaccinations, hepatitis A, hepatitis B, human papillomavirus, and meningococcal vaccinations. Many of the vaccines that I mentioned here are specifically targeted to certain groups that we will be following DOH as well as CDC regulated guidelines for vaccination. We will also be providing something that we've been providing for years, and that's HIV treatment, that Dr. DeHovitz gave the full history on that. And we will also be providing HCV treatment. That's for both the co-infected, HIV, Hep C co-infected individuals, and also we have mono-infected patients who are being treated as well in our clinic. We will be providing pre-exposure prophylaxis. How many people in the room know pre-exposure, have heard of pre-exposure? Good, all right. I think like maybe 5 years ago, we would see maybe 1 or 2 hands up. But it's exciting time. We have Truvada available now with an FDA approval for pre-exposure prophylaxis. It's a pill that you take once a day among HIV negative individuals. There are certain criteria that we use to screen to use the drug, and it has been shown if you take it daily to be effective greater than 92%. As you take it more and are more adherent to it, it approaches 100%. So we're very excited to offer this service at the STAR Clinic, and for anyone interested in experience with PrEP, I'm more than happy to talk to you after our talk here today about that. We also will provide post-exposure prophylaxis, which is taking HIV medications after an exposure. We generally try to start within 36 hours according to this New York State guidelines. Ideally, the closer you are to 2 hours is even better. And we offer that service as well. Dr. Youssef had already mentioned our substance use counseling services as well as buprenorphine. We provide buprenorphine on site for those with opioid dependence. And then I will also quickly mention we provide anal cytology for anal cancer screening and high resolution anoscopy to follow up abnormal results, which is a great service to have. I want to talk a little bit about hormone treatment. We provide hormone treatment for transgender individuals. If patients want to get their estradiol injections on site, we can provide that. We also provide oral sublingual prescriptions for oral sublingual hormones if that is preferred modality, as well as testosterone blockers, and referrals for gender confirming surgeries as well. We also provide, I think it's important to say this, case management help with changing of official documents, for example, driver's licenses, birth certificates, etc. And we can write letters to support that, so those services are available as well for our transgender community. And lastly, I will mention that we have mental health services to support all of these other ongoing services that we have as well. We have an on-site psychiatry nurse practitioner as well as MD, as well as a large group of other mental health counselors and professionals and psychotherapists. And with that, I will conclude.
Thank you, Elliot.
On your agenda now, I've been asked to talk about case management and mental health services, and I have to say I think it's been very well covered by the previous speakers. All I'm going to say is we have licensed social workers and licensed mental health providers who can provide SAMHSA-funded motivational interviewing around behavior change, as well as through Ryan White funding, we have supportive counseling provided by licensed professionals and community health workers who can go into the field. So this is a change for supportive counseling. We can now provide biomedical counseling, counseling for people who are in a serodiscordant relationship and want to talk about PrEP. We have staff trained to do that. And Dr. Youssef covered very well our case management services. They're available to the patients that come to see us. So I'm going to give it back to Daryl now.
Okay, so now we're going to have an opportunity for you to meet our Monday night team. So Dr. Jamila Youssef, if you would please do that and introduce everyone.
Absolutely. So I'd like the Monday night team to stand up and just stand to the front. So first we have Dr. Elliot DeHaan, who'll be our medical provider. And our alternative medical provider when Dr. DeHaan is away would be Dr. Rebick. For nursing support, we have Daryl Thomas and also Mary Crimes. Mary's our ANAC nurse, so she's very experienced at STAR, been here for over 10 years now. For our front desk, we have Natalie Mitchell. Come down, Natalie. Natalie has been doing all of our scheduling, and when you call, this is the voice you'll hear. She's been fantastic. Thank you, Natalie. Mental health, we have Morgan Gephardt, Ingrid Darbus, and Lori Hurley. Please come down if you're here. Morgan, Lori. Case management, we have Debbie Toloy, who I don't think I see in the room right now. And then for groups, we have a peer, Leon. So this is your Monday night team. I'd like to give them a round of applause. Thanks.
All right, thank you. You can all sit down now. What I'm going to do now is bring up our new website, which is starprogram.nyc. So this is a brand new website, and I want to thank the Internet Committee team, everyone who had hands in this for creating this website. So everything here on the website goes into depth of what everything was said today. So it's very user-friendly. Please, I would love for you, there's my face, oh my gosh, and I would love for you to go to the website and take a look at that, all right? So at this point, I'm going to bring Lori Hurley up. I think you have a slide presentation.
I do, and it'll be short.
All right.
There we go. This is just a brief history of our efforts to welcome lesbian, gay, bisexual, gender nonconforming, and transgender people to the STAR program. What bothered many of us for years is we have 1,300 right now, unique patients, over 1,300, and 19% of them are identify as MSM, which is an increase since 2012. And 1% of the patients we see are trans women, transgender women. But when you compare the New York City surveillance data, the most recent data, MSM account for 40% of all people living with AIDS. So what are the particular strengths and challenges of this community? More than half of all Flatbush or East Flatbush residents were born outside of the US, and immigrants from the non-Hispanic regions of the Caribbean account for 80% of this group. Again, the latest stats from the New York City surveillance data, 38% of new New York City HIV diagnoses were people born in the Caribbean, and East Flatbush accounted for the largest number of these individuals who were born in the Caribbean. The These are signs of our culture, the culture in this neighborhood. These are flags of the Caribbean, all on the local flower boxes on Nostrand Avenue. This is right across the street on Lenox Road. A couple of years ago, these were kids. What are people doing here? Do people know what this is? They're stilt walkers. These are kids. They're practicing to be Mokajumbi in the West Indian Day Parade. So you see them in costume, but these kids have to practice hard to walk in those stilts. Some of the challenges for the people we serve are that they come from countries where 11 of the English-speaking Caribbean countries criminalize sex between men. Only 4 of these countries publicly collect HIV prevalence data among men who have sex with men. And in 3 of these 4 countries, researchers report an HIV prevalence of more than 20%. So that's a problem. And HRSA did a study several years ago that came to the conclusion that we already know, that social networks tend to be close-knit. When service sites are located in the neighborhood, people fear that even people that they don't know personally might know someone related to them, and their status might be divulged in this way. So how have we worked to overcome barriers to engagement and retention? Well, today is one example. We're collaborating with our partners. We've provided staff education, and we've done some focus groups. We meet monthly. It's very good timing. Dr. Birnbaum just walked in, and he, as the director of the HEAT program, HEAT and STAR meet every month to facilitate smooth access for HEAT graduates. The HEAT program is the adolescent HIV treatment program that treats HIV positive and HIV negative individuals. And Dr. Birnbaum is coming in now because those monthly meetings cannot be stopped for any reason. And other STAR staff were meeting to talk about people who graduate very likely into STAR or other healthcare providers. We've worked with the community to show our face publicly. We've worked with CAMBA at Pride events. We've done evidence-based interventions in our clinic, healthy relationships with CAMBA too. Here we are at Manhattan Pride. Here we are at Brooklyn Pride Fest 2015. Yay! And we were very proud of that event because we had 6 staff and 6 patients or CAG members, community advisory members, and so we were the best on the block. That's what we felt. Yeah, we have ongoing training. This is one example. In May, we had an all-staff trans cultural competency training offered by Montefiore. And just this summer, we held focus groups and asked our patients about health, stigma, sexual orientation, gender identity, and the themes that kept rising up were healthcare starts with being recognized and cared for as you are. Good health is more than having a nice body. Getting support for depression is a big part of staying healthy. We know that. Family rejection can lead to painful isolation. And there were a number of people who believed that if they conformed to a heteronormative appearance or said that they were straight, there were people who preferred not to come out to their doctor. They believed that that was a better way to get care. Participants discussed feeling invisible within their community and church. So who do people talk to? Some people share with only one close friend. Some present only part of their identity to family and friends. And everyone agreed that disclosure needs to be a personal choice when people are ready, and that's up to us as providers to assist in that. So we are building on people's inborn resilience. It's up to us as a community of providers to support the unique potential of all whom we serve by providing integrated care. And all of you are part of that. Thank you.
Thank you.